Obesity. This is Jack Brook from Columbia Gorge Community College. In this session, what we're going to do is look at some of the parameters of obesity with the idea that we are going to talk about some of the health risks associated with obesity, looking at diabetes, heart disease, cancer, and some of the other issues that obesity brings. So with that, what I want to do is introduce obesity and talk a little bit about it. And then later we will continue our discussion when we talk about the different diseases. So by definition, if you wanted a strict definition, obesity is when you have a lot of fat versus lean body mass. So let's discuss some of that. Just as a beginning point, obesity is a growing problem in this country. As you can see, about 2/3 of the country is overweight or obese, with closing in on probably 30% obese, because these numbers come from the Center for Disease Control 2008 numbers. So we're probably closer and closing in on 30%. And the kind of the scary thing is, for nutritionists anyway, is that children and adolescents are increasing. If you look at the numbers, and you can go to the CDC website, there is a significant increase in the percentage of obese adolescents and children from the year 2000. So I'd encourage you to go look at that and just look for yourself how it's increasing, because basically the situation is, if you're an obese child or adolescent, you will be an obese adult. It's a very low percentage that can maintain their weight and lose their weight as they get to become an adult. Because if you think about it, the 66% that are overweight and obese now were, when they were children, the obesity rate was very, very low. Back in maybe the 40s, 50s, 60s. Now we have that, 2/3 overweight or obese. And so you can imagine the numbers. It could be a staggering number if we're now at the, 18% range, 12 to 19 years old already. That's obese. So it's a growing problem. It's a problem that needs to be addressed. And so that's why we're discussing it today. As far as costs, the latest costs are only from the year 2000, so you can see they're probably greater than this. They will come out with some new numbers in 2010, but a lot of money that is going towards looking at costs of obesity related to healthcare risks and things like that. Just thought this was interesting. This came out of England, but just the idea, just to give you an idea of how obesity, percentage of obesity has changed since 1980. And you can see about every 5 years or so, there's a significant change in obesity rates. And then 2010, it's getting really, really high. So this 2010 rate was an estimate, and so they guesstimate it's going to be over 30%, and so it may very well be. Just kind of interesting. Just to look at some maps dealing with obesity, and again, you can find these on the CDC website. And just look under obesity, and you should be able to find these maps. But they started about 1984 with the first map, but I'm just going to go and look at 2000. But the significance is, in the year 2000, they had, half the states maybe in the country were greater than 20%. So if you can keep that number in mind. And then we go to 2005, you can see that basically all the states except for 3 are 20% or above, and then we started getting 3 states that were greater than 30%. And then if we look at 2009, what you can see is now there are more states in the 25 to 29% range. And then if we look down in the South, lots of fried chicken, I guess, there is greater than 30%, a lot of states greater than 30%. But again, these were 2009 figures, and so who knows, 2010, 11, there's probably more states than that at this point. But if you look at the scale, we're still looking at the BMI, and we'll talk about what the BMI is in just a minute. I just thought this was an interesting graphic, how many bariatric procedures have been done in, look at women, 1999, 2001 versus 2002, 2004, an extreme number of bariatrics. So this is becoming a common practice. And then, looks like a common practice in 18 to 44-year-olds. So it's becoming part of the healthcare cost, is these bariatric surgeries. So I thought this was just kind of an interesting graphic. In the past, as nutritionists, dietitians, we had the mantra had been in the 90s to eat low-fat foods, and consumers were doing well at that. Actually, if you look at the percentage of high-fat foods that are eaten, it has decreased. The problem is that in the decrease of high-fat foods, individuals and consumers are now eating more food. So the concern now is not so much low-fat foods, even though you see a few advertisements about it. The real key is reducing the amount of food that we eat, or the serving sizes of the foods that we eat. The latest figures that I could find for dietary intake, you can see the difference in the total food that we've are intaking on average in a 30-year span from 1970 to 2000. We're talking about 300 pounds of food more per year. That's incredible. And then carbohydrates have increased. One of the things that happened was we were eating more low-fat foods, but we're increasing the number of carbohydrates that we're eating in the shape of maybe sugars and things like that. But looking at the graphic, you can see that we pretty much are eating more of everything. It's not just one thing. It's we're just eating more food than we have before. As you can probably imagine, we are not increasing our exercise or physical activity or movement enough to compensate for that extra food intake. Therefore, obesity rates are getting high. But I thought this was kind of an interesting set of statistics. Just some statements that have come out. The obesity issue is not just a problem in this country. This is an international problem. If you look at the data that you can gather from the different countries of the world, you'll see that almost every single country, the obesity rates is increasing. And one of the reasons that this person, I think this person is from Jamaica, but I'm not sure, is that a lot of people are eating a lot more fast type foods, and they're eating a lot of fat, they're eating a lot of sugars, and they're adopting more of a leisure type of style, work style, and ethic. And because of technology, individuals are not having to have as much physical output in their everyday work activities. And so the change of diet and the change of activity worldwide is leading to an increase in obesity in most countries of the world. This is kind of an interesting statement from National Geographic of 2004 is, we're getting plenty of food, you know, we're, we're not having to work as hard, we get a lot of leisure time, and it's killing us. So it's, as we get more affluent, the problems with obesity and also the problems with diabetes and heart disease and cancer become more and more prevalent. So it's kind of an interesting statement. Looking at the different obesity classifications, we're going to focus mainly on subcutaneous and visceral obesity. So subcutaneous, and we'll go over this individually, but just as a starting point, subcutaneous would be the fat that is in the subcutaneous layer of the integumentary, which, if you know your anatomy and physiology, you have the epidermis layer on top, and then you have the dermis, and then you have subcutaneous, which is filled with fat. So subcutaneous obesity is going to be an increase of fat within that subcutaneous layer. Visceral obesity is going to be underneath the rectus abdominis muscles in the abdominal cavity, and it's going to be a buildup of fat in the mesentery and the greater omentum around the intestines. So we're going to focus on those two classifications. If we look at subcutaneous obesity, there's two forms, abdominal and gluteofemoral. And again, this is fat distribution that is outside the body cavity in the subcutaneous layer, and it's kind of the jiggly kind of fat. So it's the Santa Claus fat, or it's the fat that's on your hips, or the fat that folds over your belt kind of stuff in your stomach. So it's a more movable kind of jiggly kind of fat that you can pinch, and you can pinch the inch kind of thing. So that would be the subcutaneous obesity. Visceral obesity has two types depending on where it is, omental and mesenteric. So omental would be fat that's within the greater omentum, which is kind of an apron that starts at the bottom of the stomach and then drapes over your intestinal tract, and that can fill with fat. And the mesentery would be the lining that kind of attaches the intestinal, small intestines, large kind of together. So and it can fill with fat. So both of those, though, can fill with fat. And since they're underneath the abdominal muscles, then they would push out on the muscles. And so this would be obesity in the abdominal area that's not jiggly, it's kind of hard, and so it sticks out and kind of has a real hardness to it, and you can't really pinch it, kind of thing. And so that would be called visceral obesity. It's more common in men. So women would be more prone to subcutaneous, and men would be more prone to visceral type of obesity. Which is actually not a good thing. Just looking at some comments that abdominal obesity, abdominal obesity is not a good term, because you could say that obesity, subcutaneous obesity around your stomach could be abdominal. So it's more appropriate to say visceral type of fat because it's in the visceral organs. But it has been shown that there's a higher risk for heart disease and diabetes, especially those two, with visceral obesity. So that's tends to be more than in men, and so, but women obviously can get visceral obesity at some point, and also sometimes referred to as central obesity, but we refer to it as visceral. can also make LDLs smaller and more dense. And when we get into the heart disease section, what we'll find is that the small, dense LDLs are the ones that are more susceptible for becoming part of plaque. So that would not be a good thing. And then dealing with diabetes, the visceral obesity, when you start using those lipids, those free fatty acids, they will go directly to the liver, causing insulin resistance, which is a huge cause of type 2 diabetes. So visceral obesity is considered the worst type of obesity. Subcutaneous is uncomfortable, and so makes bigger size people and stuff like that, but it doesn't relate as much to disease as the visceral obesity. Looking at how do we define obesity, what are the measurements of obesity? Body mass index is the one that's commonly used. You'll notice in hospital records and things like that, they will use BMI. And these are the parameters, weight per kilogram divided by height squared in meters. And you can see the scale, basically normal between 18.5 and 24.9, and then over that you have overweight up to 30 obese, and then extreme obesity would be greater than 40. But body mass index is not really a good indicator by itself, because you can have somebody that's a muscle builder that would have a very high BMI. And so if you remember the definition that we had at the very beginning of obesity was the amount of fat per muscle tissue. And BMI really doesn't measure that. So there are other measures that need to go along with that, and some things that they're actually doing in some physicians' offices, also recording waist circumference. And obviously this would be looking at visceral obesity a lot. And so if men have a greater than 40-inch waist circumference, women 35 inches, then that would be considered another assessment. So if you had a BMI plus a waist circumference, those two would be better indicators of obesity than just the BMI itself. But at this point, BMI is considered the reference standard for obesity. Then you can also have your body fat percentage done, which would be an excellent thing to do, because one thing, if you're trying to lose weight, if you're losing weight, you want to make sure that you're losing the fat weight, not total weight, because you can be losing water, you can be losing muscle, and you want to lose the fat. So you want to maintain a good lean body mass, and you want to maintain a low fat percentage. So it'd be very good if you're losing weight to get a frequent fat percentage done to make sure that you're losing weight and not losing water or muscle mass, because that wouldn't be good. That's why really bathroom scales aren't the best assessment of weight, because when you step on a bathroom scale, you're basically determining gravitational push, and you're not really it's not really telling you where you lost the weight. Because yes, you could lose 5 pounds, but what 5 pounds of what should be the question. If you're getting your fat percentage done and you lose 5 pounds and your percentage is going down, then you're pretty sure that you're losing the fat weight, which is what you want to do. So bathroom scales really aren't the best assessment. And I don't know. I'm not sure I would even have one. I just wanted to introduce you. We will talk about this when we get into heart disease also, but just to introduce, metabolic syndrome is an assessment tool that's used to determine risk for some diseases, so especially heart disease and type 2 diabetes, because some of the causes of metabolic syndrome, insulin resistant, obesity, uh, unhealthy lifestyle, hormonal imbalance, so these can all relate to metabolic syndrome. But some of the risk factors of metabolic syndrome, and you can see I've kind of reddened visceral obesity, because visceral obesity is one of the indicators of metabolic syndrome, along with some of the blood levels. And if you listen to the heart disease um, audio, we'll go over the high triglycerides and the small dense LDLs and that kind of thing. So get an understanding there. But the diagnosis, if you have metabolic syndrome, 3 or more of the above risk factors, if you have 3 or more, you're considered to have metabolic syndrome, which um, can be a very good indicator of risk for potential diseases, and you need to address metabolic syndrome. And so your physician would try to help you to reduce those risk factors. Complexity of obesity, the question is, what causes someone to become obese? Obviously, you can look at the scale and say, well, calories in, calories out. You take in more calories and you don't uh, use or expend calories, then obviously you're going to gain weight. But it could be that you'd say that that's a pretty simple thing. If people would just eat less and exercise more, then we wouldn't have this problem. And that's kind of a simplistic look at the issue. But there are 2 laws of fat. Number one is, if you eat too much and eat beyond your expenditures, then your liver is going to convert carbohydrates, it's going to convert proteins, it can convert alcohol into fat. And so if you eat too much, and that's where the bulk comes in, that we're eating too much food. So some of the advertisements you'll see on the television say, well, this is lower fat than this other product. But the problem is it has more calories from the bread and some of the other things you put in it than the other item. And so your liver is going to turn those bread carbohydrates into fat, and it's going to be the same thing as if you ate a lot of fat. So we really need to look at our caloric intake, our serving size, and that kind of thing to address this first law of fat. Second law of fat is there really is a fine line between being out of balance. And I just want to give you an example of that, is that if you take, for example, 1/4 cup of orange juice. Now, that's not very much. That's one of those little juice glasses of orange juice, is about 25 calories. So if you basically didn't change your lifestyle and you said, well, I'm going to try to get some more fruit in my diet, so I'm just going to drink 1/4 cup of orange juice every day. But again, you didn't change anything else. That's all you did was just add the 1/4 cup of orange juice. If you drink that orange juice 5 days a week, that's 125 calories per week that you'd be adding. If you eat 52 weeks a year, then that's 6,500 calories extra that you've eaten that year. If you look at 3,500 calories per pound and do the math, you'd see that that's 1.8 pounds per year that you could gain just by drinking 1/4 cup of orange juice. So there is a fine line between being in or out of balance. And if you multiply that over 10 years, that's 18 pounds in 10 years. And then 20 years would be 36 pounds. And then, it just goes up and up. And you look at a 40-year span, you've got 72 pounds that, at 60 years old, if you started at age 20, at 60 years old, that's, 72 pounds that you would have gained. And that puts you pretty much in the obesity range. Um, from where you were at 20. So it doesn't take a lot to be out of energy balance. So if you start adding, something to your diet like that, you need to address the physical activity. You need to make up that somehow in physical activity. Um, so, taken from the U.S. Surgeon General's information off of, I got this again off the CDC website, is that, just looking very simplistic, well, if you'd eat less and exercise more, that's going to solve your problem. Well, it's easier said than done. Obviously, energy imbalance is the issue, but look at all the things that can come into play. Uh, there are some people, they believe they have found the fat gene, or some genes that deal with fat, and some people have them turned on, and kind of, the issue would be, some people have a gene turned on that your body wants to conserve energy because of the fear of maybe starvation or something like that. And so that gene is turned on, and so they conserve more energy. There are some people who can eat the same amount of food, one would gain weight, one would not. And so potentially the conservation gene might be turned on. A metabolic rate can be different between, there can be a 50%, 75% difference between two people as far as how high their metabolism is. But obviously behaviors, environment that you're in, what you have to eat, what your income is, um, diseases, some diseases, and where you take drugs for those, it can cause you to lose. So there's lots of potentials out there. So the idea is, you can see somebody who's obese, but, you know, before you, pass judgment of, well, they just need to eat less and exercise more. There's a lot of potentials, in their life that could play. But obviously behavior, habits and things like that, and the environment a person in, are the best things that can be used to prevent and treat obesity. Changing behaviors or changing environments, are the easiest, and it's not easy. As some of you that have tried to lose weight, it's not easy to change your behavior. It's not easy to change your environment. But those are the basically of the other options. I mean, if you have a disease and have to take drugs, there's not much you can do. Sometimes you can't change your socioeconomic status. You can't change, maybe you don't want to. Maybe you can't change your culture, who you are. You can't change your genes. You can't change really your metabolism. You can a little bit with a little bit more activity. But behavior and environment are going to be the key areas um, to address this issue. So how do we treat obesity? Again, from the CDC website, you have to be willing to do it. It's one of the most emotionally draining and hardest things to do emotionally, is to try to change your behaviors and then change your environment. So you have to really want to. You have to put it as a high priority, that you're going to be able to say no. You're going to be able to reduce your serving size. And you're going to be able to make adequate choices when other people aren't making those choices. And so you have to be able to, it's one of those things that you really have to want to do it. And you want it so badly that you're going to be able to make those difficult emotional choices. And so there's lots of possibilities how you would do that. Diet. I don't really like the word diet because it's more of a behavior change, because we all know how to eat. It's just the idea of changing our behavior to match what we know we should be doing, kind of thing. Exercise. Um, Exercise is kind of a word that you don't hear much anymore, because there's some people who believe that if you use the word exercise, it makes people think they're going to have to sweat, and then they're less likely to do it. But if you use the words increase movement or increase physical activity, then those are not quite as negative of words. And so when you see people, see advertisements about what I would call exercise, uh, I would say that you won't hear that word. You will hear movement or physical activity, that kind of thing. Behavior modification, lots of habits that need to be broken. Maybe when you sit down in your chair, it makes you think you want, because you always eat there. So when you sit in that chair, it makes you want to eat. You feel, even though you're not hungry, it makes you feel like you want to eat, kind of thing. And then potentially you may have to have weight loss drugs or bariatric surgery, possibly. Who knows? Rules of thumb. When you start going on a weight control diet, it is a lifelong thing. I don't like the terminology going on a weight loss program, because a program has a beginning and it has an end. And when you have an issue with weight control, it is an issue that you will have to deal with the rest of your life. And so there is no end. There is a beginning, but there is no end. It's more of a process of changing your behaviors a little bit at a time. Now, you can't do everything overnight. So you have to make little adjustments in your behaviors and work at it a little bit at a time, kind of like, when you do physical activity, and you're pumping weights, you don't start at 600 pounds. You work your way up to 600 pounds. It's the same thing. When you do behavior modification, you have to do little things, get those victories, and then add another little thing until, it's a lifelong effort that's never going to end. So I have issues with um, buying diet pills or going on diet programs that you can't live with the rest of your life. You have to be able to live with it. So my idea would be to eat what you normally eat, because in reality you can eat anything you want to. It goes back to moderation and variety, and because from your own experience and from other experiences and other people, that most people, it's a very low percentage that actually lose the weight and keep it off. And one of the reasons is that people do something totally different than they really want to, and they don't stay with that diet. So my feeling is eat what you normally eat, but if you can fit in that variety and moderation piece and change your behaviors, then you can eat what you normally eat and what your family eats, and you're more likely to stick with that program, that process. We'll call it a program. Stick with that process the rest of your life, because you still are being able to eat what you normally eat. But again, you have to be realistic. Um, 1 pound a week is probably ideal. Now, 2 pounds a week potentially. Any more than that is probably not realistic, even though it can happen. There are drugs you can take, weight loss drugs. There are things you can do, and you can lose more than a pound a week. But the key is going back to, is that fat that you're losing? Probably not. Probably water, muscle, and fat. You don't want to lose muscle. You don't necessarily need to lose the water. You want to lose the fat. So the expectation would be 1 fat pound per week that you need to lose, which is very slow. But if you think about it, over a year, that's 52 pounds. And at that pace of 1 pound a week, you're going to more likely be able to stick with it once you get there. Okay, so we have to be realistic, and we have to lose our weight slowly and properly, because anything that's worth anything is going to be, it's going to take a while, it's going to take some effort, but the rewards, health wise, psychologically, are going to be well worth it. You just have to have some patience, and in our society, that's hard to come by. So realize if you're getting into a situation where you need to lose some weight for health reasons or for personal reasons, it's going to be there for the rest of your life, and you have to be realistic. Okay. Eat what you normally do, but eat healthier what you normally do. Okay. Watch your portion sizes. You still have to watch fat intake, but the key is to watch calorie intake. Watch those portion sizes. And then get on an activity program, an exercise program, physical activity program, movement program, whatever you want, at least 30 minutes per day. That's the minimum that you want to do. My understanding is, I'm not, a physical therapist or anything, but my understanding is you can do these in increments, 10-minute increments, 3 times a day. But the key is to get, moderate intensity means you need to get that heart rate up. And because fat is only burned efficiently using aerobic activity, which basically means you need to keep within your target heart rate, but you need to reach that target heart rate. And so you need to have those intensity, that activity, get your heart rate up to where it needs to be, and keep that up there for, the 10 minutes. But you want to work your way up more than 30 minutes if you can. So, the goal ideally would get up to that 60-minute, time period. And over time, you've got to be patient. Okay. And again, if you're never exercised for a long time, start with 10 minutes a day, and then increase that to 15, and then 20, and then 25, and then 30. So it may take you a month or so to get up to that 30-minute time period, but it's better than trying to do it all in one day and then get frustrated and quit. Okay, so again, obesity is a huge, huge health concern. It's related to several diseases, and you really, as a society, we really need to get a handle on it. But there's nobody that is going to be able to do it for you. I do not recommend taking weight loss drugs unless your physician recommends it. And so there's no simple answer. It's a lifelong effort utilizing realistic expectations eating healthier, and getting on an activity program. That's going to be the key. But you have to have the want to. You really have to deal with it yourself. Okay? Now, there are helpers out there. There are registered dietitians. There are physicians. There's physical therapists. There are people who deal with exercise physiology, and they can help you, trainers and things. So there's lots of people to help you, but the most important person that can help you is yourself, because again, you have to have the want to do it. So let's go do it.